Hello and welcome to By the Numbers, a public health podcast. I'm Addie Olson, the Public Health Communications Officer for the Polk County Health Department. And I want to dive right into this episode. We're talking about a really big topic, which is cancer and rising cancer rates. And we'll focus more specifically on breast and cervical cancers, but wanted to open with a more general number. So nationally, cancer rates have been on the rise. And Iowa has the second highest cancer rate in the U.S. for the second year in a row. So to talk more about this, I have the Health Department's Disease Prevention Supervisor, Carrie Levitt-Townsend, joining me on the show today.
Good afternoon.
And hi, Carrie. Thank you for joining me.
Thank you for focusing on this topic.
Absolutely. And you are like a wealth of cancer information. So anything that comes to mind right away when we talk about rising cancer rates and some of the cancer trends that we're seeing, particularly here in Iowa?
Well, in addition to the statistic you shared, Iowa also has one of the fastest growing rates of new cancers. So that's newly diagnosed cancers. And the largest proportion of those new cancers in Iowa are attributed to breast cancer. So this is an important topic as we are approaching October and Breast Cancer Awareness Month. I'm glad we're talking about it today.
Absolutely. And just how much more quickly is breast cancer growing than some of the other cancer rates that we see rising?
Well, as I just shared with you, seeing that this is, we're having so many more newly diagnosed cancers in Iowa, and so many of them are attributed to breast cancer, certainly concerning.
And do you have any data, any other data about the state that just speaks to the cancer rates that we're seeing here in Iowa and just how it compares to some of the national trends?
Well, from the most recent cancer report, currently they're saying that 2 out of 5 Iowans will be diagnosed with cancer, just based on, the statistics we've been talking about.
Wow.
Here now. So, and breast cancer is at the top of that list.
Absolutely. And I know that you are having a lot of conversations with survivors of breast cancer, people who are newly diagnosed, with patients just based on your work at the health department. And what are some of the things that you're seeing in the people who are coming in and being diagnosed with breast cancer? I know that you've mentioned before, like people are coming in at a much younger age than we're used to seeing after finding a lump or an indicator and realizing that they have breast cancer. And that's pretty jarring to hear about somebody like young in their 20s, coming in and finding out they have breast cancer.
Well, and exactly. And really what we're seeing is younger and younger women diagnosed with breast cancer. One of our most recent cancer patients diagnosed at the age of 25, and the breast cancer is not contained in the breast. It's actually already spread to some lymph nodes as well. So to see someone so young diagnosed with breast cancer and having it already spread at the time of detection is concerning. So with both breast and cervical cancer, we're seeing younger and younger diagnoses.
Is there any way to say why that is?
I wish we had an answer that would help us with our prevention efforts. I mean, I think there's a multitude of factors that come into play, and there are a lot of people that are working on that. In the meantime, what we're hoping to do is make more people aware of the program that we have, especially those that are uninsured and underinsured, so that we can help them get screened, and we can detect cancers earlier when they're more treatable. And, that can be an effort that we can make towards better health of Iowans and those in Polk County.
And our program offering free heart health and cancer screenings just got a bit of a rebrand. So do you want to talk a little bit about the program and what we're calling it now?
Well, we've got quite a bit of a rebrand recently, actually. We've been known as the Healthy Women Program, and we're rebranding with the name Ribbons of Hope to be more inclusive for several reasons. one of which is we also offer colorectal cancer screenings. And then we also have new Polk County funding to be able to provide heart health screenings as well, and healthy behavior support services to accompany those screenings.
Okay. And it's just for the program is specifically for people who are uninsured or underinsured. Maybe your insurance just doesn't cover cancer screenings.
Right. So Ribbons of Hope is for those that are 250% of the federal poverty guidelines or below, who are uninsured, so they don't have any health insurance to cover screenings or other healthcare services, or they have insurance, but maybe they have a very high deductible, and so they're paying out of pocket for services, or there's a test that maybe they won't pay for, and we can cover that test and allow their insurance to pick up all the other coverage they do provide.
Okay. And what's the best way for someone to get connected with the Ribbons of Hope program?
Call us. Can call the health department. We have a main line for the program, which is 515-286-3642. Just give us a call, and the staff will be happy to talk with you and tell you about the program and how we can work together. They can help you enroll over the phone. We also work with many providers and radiology facilities who also enroll their patients, in the clinic or at the radiology facility. If maybe their insurance status has changed and they were insured at the time they scheduled the appointment and they're uninsured when they come that day for their appointment, we can get them enrolled quickly and authorized, and they can keep their appointment that day.
Okay. So you just give us a call, get connected. If you're connected through another source, that's also great. We just want to be sure we get in touch. And then we offer breast, cervical, colorectal screenings, and heart health. Was there one more?
That's breast, cervical,
I got 'em all.
colorectal, and heart health. You got them all. And some people walk into the health department too and, want to talk with the staff person in person. And we can very often fill out the enrollment application right there at that time.
How does someone know if they should get a cancer screening?
Well, even taking one step back from that, I'd like to start with people knowing what's normal for their own body. When we're talking about breast cancer, knowing how your breasts normally look and feel. And then if you notice any changes, changes in the skin or size, shape, maybe feel a lump, then that's important to get a hold of your provider and talk with them about what those changes are. And they may go ahead and do some testing or do a mammogram, maybe a clinical breast exam. So they'll look into that and make a determination. Very often someone might have a concern about something and it's not cancer. But if it is, we want to detect it as quickly as possible. So knowing you're normal, really for your entire body, when we're talking about breast and cervical cancer, we're talking about knowing what's normal for you with your breasts. And then also just with your cycle and things like that. And when you have things that are different or unusual changes, talk to your provider about it.
And I think know your normal has been just a great lesson that I've learned from you in prevention and really being in tune with your body. I think that a lot of times we are eager to explain away different symptoms or abnormalities that we're feeling and say like, oh, I got a bruise there. I have a lot of bruises, but I was cleaning and ran into something. It's just easy to explain things away rather than address persistent symptoms that we're seeing that could be larger problems. So I guess, do you find that in your work a lot that people are coming in and maybe have explained away symptoms for too long, and that's led to the cancer or diagnosis being in a more advanced stage than it would be if they'd come in sooner?
I think more often than not, we find that someone might put off doing anything about a sign or symptom that they see because they don't have insurance, and they're concerned about how they're going to pay for it. And that's why we want everybody to know about this program so they can get in touch with us so that we can help them get screened. And we can bring someone in at the point at which they think they have a lump in their breast, and go ahead and help them get a diagnostic mammogram and see a provider. So that's coverage we can also provide. So I think that's the number one reason we see people putting things off. More on the routine mammogram screening side, I think sometimes people put it off like, oh, it's going to be uncomfortable, or, maybe they're afraid, they don't want to go looking for cancer. But there's a lot of peace of mind in getting that screening done and everything's normal, and can feel good about that result until the next screening time. And if there is something that they're concerned about, sometimes it's just looking into it, doing some additional diagnostic imaging. And again, things may turn out to be fine, but if it's cancer, we can detect it earlier. When we can detect it earlier, we have a lot more options. It's more treatable, and that's what we want to do.
Absolutely. And I love that the Ribbons of Hope program makes care more accessible, because access to care is a huge barrier for folks in getting the good medical care that they need and deserve.
Yeah, I hate to hear that, somebody felt a lump and they were afraid to go to the doctor because they didn't have insurance, and time is passing, and, time is important in terms of acting on that if it is cancer and getting it treated.
Yeah, time is definitely of the essence in those situations.
Yes.
So know you're normal. That's, one of those key messages that we want to make sure that we're lifting up when it comes to prevention.
The other thing I would emphasize with knowing you're normal is that mammography, routine screening mammography for someone at average risk, usually is not recommended to start until age 40. And we are seeing breast cancers diagnosed in women in their 20s and 30s. So knowing you're normal and seeing your healthcare provider are your most important prevention steps that you can take, your most important things that you can do to take care of yourself. And so that's really, really important to notice changes and get them checked out, and get into, maybe they'll start doing some more routine screening after that, depending, or doing some short-term follow-up after they've done and looked into maybe something that was concerning. So but that's the line of defense before 40. So it's really important.
And looking at going from breast to cervical cancers, I have another data point from the CDC, and it states that over half of cervical cancer cases occur in women who were rarely or never screened. So that speaks to that piece about, if you're not getting screened, it's harder to catch.
We can't catch it if you don't get screened. And cervical cancer screening should begin at age 21. And as of 2 years ago, our program can cover cervical cancer screenings starting at age 21. So we're very excited about that. And, we are detecting, abnormal results, and helping women through the program cover the costs of preventative procedures that can help them prevent cells from becoming cancerous. So that, again, that early detection is very important, and particularly with cervical cancer too.
Yes, absolutely key. And how big of an impact does the Ribbons of Hope program have? And what are some of the things that you're seeing through our work doing free cancer screenings?
Well, I think the staff is amazing. They care so much, and they provide such great education to anyone who calls, trying to help to connect them to resources as well, but also navigating them into screening. And if they do have an abnormal result, being there to help explain, provide information about what's happening, about next steps, really being supportive. We can provide some additional assistance with regard to transportation and things like that that might be helpful if needed. So I think we have a nurse case manager that's also there to walk along the way if there's diagnostic testing that needs to be done, and help someone understand, clarify what questions they maybe want to ask their providers. So there's a lot of support in addition to providing coverage for that office visit, for a mammogram, for the cervical cancer screening, either a PAP or HPV test. There's also staff there to support people along the way.
So you're not just coming in, getting your screening and leaving and never seeing or hearing from us again. Really, our team's going to be there with you every step of the way through Ribbons of Hope. And getting to work with the team, I know just how amazing they all are.
Yes, they really are, and want to help make a difference, and also help look for other options, maybe through the Affordable Care Act. If someone is eligible, sometimes people don't realize that they are eligible, so they can help connect them to insurance, say through the Affordable Care Act, or financial assistance through a hospital or a clinic system if they need it as well, above and beyond what we provide.
So being able to make those connections to the right places, the right resources for whoever needs them.
Yes.
And what are some other things that we're missing in this conversation? Anything else that you definitely wanted to touch on when it comes to breast, cervical cancers, rising cancer rates in Iowa?
Well, I'd like to circle back to help us spread the word about the program, help people to know we're here, so that someone that needs a regular screening that maybe has never been screened for cervical cancer or hasn't been screened in a very long time, maybe never because they haven't had insurance, help us connect them to our program so that we can provide those screening services. And I think the other thing is, know your family history. That's another factor in terms of whether or not someone might be at increased risk. Talk to your provider about, again, what's normal for you and if there are changes, but also talk to your provider about your family history. So we know that the number one risk factor in breast cancer is being a woman. So you don't necessarily have to have a family history to be diagnosed or to have breast cancer. So again, that's where knowing you're normal and getting a mammogram is so important.
And we're going to be spreading our message of Know You're Normal on ray gun shirts pretty soon here, which is exciting.
We're so excited about that.
Yeah, and some of those proceeds will go back to support the Ribbons of Hope program to actually provide free cancer screenings and that great support that you just talked about.
Yes, and knowing you're normal can save your life, could save someone else's life. So just know about our program, and if you're insured, great. But also, if you're insured, make sure you're getting your screenings done regularly. And it's still important to know you're normal with insurance and to talk to a doctor or your provider if you see changes. But if you know somebody whose insurance status has changed and they're not going to get screened because they've lost their insurance, please connect them to our program. Contact the Polk County Health Department and help them get enrolled.
Perfect. And you can also go to the health department's website and click on services and be able to pull up that Ribbons of Hope free cancer and heart health screenings page just to learn a little bit more about that.
Yep. There's more information. There's more information about screening and how to contact us.
Awesome. Any other closing thoughts?
Well, as all too soon, it's going to be October. I can't believe it. But October is Breast Cancer Awareness Month. And so there'll be a lot of things happening to remind people to promote awareness. So, but we need to continue to do that throughout the year. And also remember, cervical cancer screening awareness is important as well.
Absolutely. We got to wear our pink for Breast Cancer Awareness Month. We didn't get the memo today in our green shirts.
No, we didn't. We didn't. And January is Cervical Cancer Awareness Month. So that's a good time to promote more awareness about that as well.
Awesome. Well, thank you for joining me today. And thank you for listening or watching this podcast. Be sure to stay tuned to By the Numbers, a public health podcast, for future episodes.